So, disorders of the skin, right? It's going to be a lot of rashes, a lot of gross pictures. Just power through it. You chose this life to a certain degree. So did I. All right, so yeah, we're going to talk about background of the skin, some disorders, some primary disorders, and then talk about UV radiation, stuff like that. I don't know. You'll see when we get there. Right, skin's really important, right? The largest organ of your body. And it's very immunologically important, obviously. We talked about it a couple times where it's the barrier between the inside of your body. It's the major barrier between the inside of your body and the outside of your body. Technically, right, your gastrointestinal tract is outside of your body, like topologically. But and so the barrier there would be your intestinal tract and your stomach and your esophageal canal. That's technically a barrier to inside and outside your body, but this is the major one, right? And so it's really vulnerable to, if a pathogen wants to take advantage of like getting inside your body and the nutrition that's inside your body, it will have to penetrate that level, right? And of course, we have immune responses to prevent that, to where a lot of the things that pop up are going to either be caused by the sun, parasites, and different pathogenic stuff. And obviously, it affects all ages, cultures, everything, right? So your skin, largest organ of your body, protects against injury and microbes. Prevention of fluid loss is important. There's that dry layer, and then the oil as well. And then it's also involved in your vitamin D anabolic pathway. So one of the intermediate, people love saying you get your vitamin D from your sun. A little misleading in that you get your vitamin D from your nutrition. Just there's did y'all take organic chemistry? Did all y'all take organic? Okay, so you definitely took it, right? So you might have talked about radical reactions. One of the important things of a radical initiator is UV light, and UV light from the sun. There's a radical initiation event of one of the intermediates of the metabolic pathway for vitamin D to make vitamin D. So, and that will happen at your skin level. So it's involved in the vitamin D anabolic pathway. You don't actually absorb vitamin D from the sun. All the sun it is light, right? So it's like there's equivocation problems going on there. But regardless, this is your dermis layer. It's a connective tissue. There's your connective layer that connects the outside of the epidermis to the actual. There's like a fat layer right there. With this dermis layer, this is actively replicating cells, actively replicating. The very outermost layer is mostly dead, though. After that replication process is done. Then there's the hair cells here, and then there's oil and sebaceous glands that waterproof your skin as well, or contribute to it, and you got your hair follicle. This is just kind of the background of what skin looks like. We're going to mostly be looking, so there's a whole bunch of different cell types in your skin, obviously. There's the keratinocytes, which is the major part of the epidermis. That's that dead layer. There's melanocytes. These are what produce melanin, which is a pigment to protect against UV radiation. And then we got your Langerhans cells, which are a specialized type of, I think it's almost like a specialized type of macrophage, I'm pretty sure. I probably want to double check that, but regardless, it is a specialized immune cell that lives only in the skin. And we have sebaceous glands and that secrete oil and liquids that lubricate the skin and hair so that it doesn't dry out. Most skin disorders are characterized by lesions and rashes, or pigmentary skin disorders. It can also be itchy or dry, and we'll talk about different problems with all four of these today, obviously. So with lesions and rashes, with what a lesion is it's a traumatic or pathogen or pathologic loss of normal tissue continuity, structure, or function, right? This is like everyone knows what that is. It's cuts, it's scabs, it's bug bites, stuff like that. So there are primary lesions and secondary lesions. Primary lesions arriving from previously normal skin. Secondary lesions are other diseases or conditions. A rash is a general term for a seborrheic skin eruption. So this is where, again, people know what rashes are: lesions that cover small areas or large areas of the skin. So these are things like chickenpox, diaper irritations, rash-induced reactions. Individual components of a rash are often referred to as a lesion. So, right, like each little pox of a chicken pox is a lesion within the rash, right? So here's some beautiful examples of this stuff. If you didn't know what a rash looks like or what a lesion looks like, those are some great things. So the important things to consider when we're talking about this lecture specifically is the location of everything, the color of everything, the configuration, the texture of it, if they're like bigger bumps or smaller bumps, and then the morphology. What does the border look like, right? Those are letters of the alphabet.
Yeah, that was our health assessment thing. What was it again? Asymmetry, border, color, diameter.
There you go. Yeah, this sounds good. I don't.
And then funny looking.
Gotcha. Yeah. So yes, then all that is applicable, and a couple of the diseases that those things are applicable to are albinism and vitiligo, which are pigmentary problems. So this is where you have, right, melanin is produced by melanocytes, and if you have defective melanocytes, just genetically, what that'll lead to is albinism, which is just a complete lack of melanin or pigment production generally across your whole entire body. Very rare, about 1 in 18,000 people in the U.S. get it. Very pale skin. If ocular problems, because right, you need pigmented cells in your eye to absorb light. So you have when you have problems with your pigment production, you have problems with that as well. Increased number of sunburns and skin cancers. Obviously, that's what melanin is evolved to produce. And so what people have to do is they have to put on excessive amounts of sunscreen, and they have to correct their vision problems that they have. Vitiligo is also a melanin problem where you have this patchy problems with production of pigments where you have very sharp margins on this. So I don't know if y'all have seen people with vitiligo before, but yeah, this is like a picture of it where you have like very defined borders. But it mostly affects darker pigmented people. There's actually like white people that get vitiligo as well, but it's like not as yeah, there you go. That's a good word for it. Not as noticeable because
well, actually, I do know a white girl that has.
Yeah, so it's like what it'll.
Yeah,
there's a debate. That is the theory. Who's to say that?
What was confirmed on his autopsy that he had?
Yeah, I don't know. I'm not in this debate. I don't know. There's people very passionate about Michael Jackson and vitiligo, but I am not one of them. But yeah, what'll happen with white people is that they'll like it's like it only pops up when they tan. So like if you're just sitting inside all day, but like for people who like live on the coast or like will like go out at beaches a lot, you'll see like certain parts of their skin just won't tan like other parts will, and so there's like that's like a version of vitiligo, but it's not like a problem for as big of a problem for like those people as it is maybe culturally or socially with like people who are more affected by it. There are cosmetic treatments, so you can like increase the blending area or try to lighten certain affected areas. It's like something that you just got to cosmetically deal with. Melasma is another thing where you have these dark macules. Mostly affects, where does it say? Yeah, South American, Asian, or Indian people. And you have these little ground berry patches, especially on the cheeks. They really show up, and along the jawline, apparently. And it's more common in women and will pop up during pregnancy or if people start using oral contraceptives, probably indicating that it's regulated at the hormonal level to some degree. But it's exacerbated by sun exposure. Again, this is just another a pigment problem, right? Where you have just increased production of melanin at these areas. So you can sunscreen or go through bleaching as well. All right, pruritus, right? So this is, simply put, having being itchy. Can range from mild to severe, and there are certain purigens, so chemicals that cause itchiness. So things like histamine, which is like, so that's what's going on when you have like a whole bunch of rashes that you have like, because rashes are mostly regulated by the immune system. The immune system releases a whole bunch of things that cause an inflammation, and so one of the things is things like these are purinogens, where you have histamine and serotonin. And so what's great about those is that if you just there are certain chemicals that combat that, things like antihistamines that we've all heard of, that can decrease itchiness. And there's can even be ectopic applications as well. What is that? Benadryl. There's like you could pop a pill or put the cream on, right? And then it helps with itchiness. Right. It's just itchiness. Treatment specific underlying. Yeah, you want to treat whatever the underlying disorder is that's causing the immunological reaction. But there's also just you can do things like trim your fingernails. I don't know. I have a big. Yeah, so you don't. It's not really. So you don't scratch as much. The thing is that like there's a little bit of a debate, not really among healthcare providers, but among like academias about whether or not people should itch their itchinesses, right? Where it's like because the question is that like we've evolved itchiness to scratch, right? So what the theory is that you want to open up that wound, release whatever is caused, like the thing that the immune system is reacting to. Like if it's a bug bite, you want to scratch your bug bite, it releases all the toxins that the bug just deposited, and it relieves all the swelling that popped up from it. And so what that allows is for just more repair cells to come in and then ease over that scab, and then you heal faster. So the contrast to that is you don't itch. You still have the toxins. The immune system all just gets rid of it through phagocytosis and things like that. You have a relieving of the pressure just by your blood system, and then you have a repairing of the damage in that way. So it's like whether or not you should scratch stuff. I'm convinced you should, but there's a whole bunch of people who say you shouldn't. They're mostly concerned about secondary bacterial infections because you're opening up a scab and then you're exposing the microbial world to your body. So I don't know. There's a debate here, but there's other ways around getting rid of pruritus, cold applications, anti-itch agents, and stuff like that. There's 4 different types of pruritus where they come from. It's generated at the skin level. It's in your head. Affect organs that generated in the central nervous system. Neuropathic is due to nervous system blocking normal responses. So things like shingles are very painful, but still very itchy. And then there's psychogenic, where you have emotional or stress related. There's like, it's like when you get scratched. My best friend in college, she would, when she got stressed out, she would always like rub her face like that. And it says like she's like itchy. And so it's like, that's like a great example of the psychogenic thing. Or picking at your skin. You see that like people rubbing the back of their necks when they're stressed too. Like it definitely is a thing. Dry skin's another thing. Yeah. So you get dehydration of the epidermis. The problem here is well, we're getting there in a couple slides. So just
what is it? XEROSIS?
Oh, like that extreme dry skin condition. Yeah. I don't know how I'm bad at spelling, but so yeah, this is mostly caused by dehydration of the skin, but it's a lot of you're missing your oils. That it's not really hydrating your skin as much, but it's like keeping your skin from being dry, I guess, because you're trapping in the liquids underneath, and so that's really what's going on. Can be naturally occurring, associated with aging, or caused by symptomatic. So there's diseases that cause dryness, or it just happens with aging. Severe pruritus, most so it's really, really itchy, and then the scratching results in crackling, and you can just make things worse. So a big thing here is just if you got chapped lips, you just want to moisturize it with things like chapsticks or lotions, room humidifiers, changes in soaps, anti-itch additives. Yeah, so that's most of the manifestations of skin disorders. So then we're going to get into really what I consider the meat of this, which is like the primary disorders of the skin, the underlying causes of what causes different skin problems. So with this, you have dermatosis. It's any condition, any skin condition involving acute or chronic lesions and eruptions. So there's primary dermatosis, and those originating from the skin. So we're going to be talking about a couple infectious problems here, right? So we have fungal infections, bacterial infections, and viral infections. So with fungal infections, the big one here is tinea. So this is the fungus that causes, man, the facial expressions on y'all are entertaining this lecture. But the thing is, another thing is when you look at all these pictures so much, you get dead to seeing like gross stuff. And I'm sure all of you will get there as nurses eventually. Anyway, the so tinea is like a fungus that causes a whole bunch of stuff. So it's the causative agent of athlete's foot, which is like a big thing if it's around like locker rooms and stuff like that. But it can really infect a lot of different areas, whether you're on the body, on the scalp, tinea of the scalp, or on the nails. And so this is a fungus that is just replicating outside your body. So it's like just using your skin as like a attachment spot. Great thing about this is that it's very, very susceptible to antifungals. So like if you've ever got an athlete's foot and then you just put or athlete's foot cream on it, it like kills it in like a week. And so it's like really easy to get rid of, but you just gotta do the treatment. There's also you can use you can diagnose stuff with fungal spores. You don't really, I mean, a lot of times you can recognize it by like what the actual skin looks like, but you can also it is typically kind of itchy a little bit sometimes. But yeah, just treating these people with antifungals, and then it usually wraps up pretty quickly. There's also really bad bacterial infections. So they can be primary or secondary. With primary infections are superficial skin infections. This is infection of the skin itself. Right? A secondary infection is going to be like a bacterial infection of like your body, and then like you have like an atopic immune reaction to it. Of deeper cutaneous infections such as infected ulcers and stuff like that. Impetigo is a common superficial caused by the Staphylococcus, this beta hemolytic streptococci. So beta hemolytic means you have the ability to lyse hemoglobin containing cells. So this is like bacteria that infect red blood cells effectively, but just because you're beta hemolytic does not mean that you infect red blood cells, insofar as that's like more of a in vitro diagnostic tool, but it's about where the bacteria are is where it's going to really infect. Really what that says is that it infects human cells pretty well, and so if those things are keratinocytes or other type of skin cells, then it can infect those as well. And then streptococci are particularly bad bacteria. But what will happen is that it forms all these pustules, long story short, or large bulb on the face of your body that look almost like orangish or like yellowy orange, honey colored. There you go. And it dries with like a crust. And so they keep reappearing. So like they're pustules, you scratch them and then they like rise up. You can like relieve them a little bit, but then they'll just reappear because you're not treating the underlying cause. So the important thing is getting rid of the bacteria right through and through, and then you can start to treat this stuff. Pruritus results in scratching, multiple infections. Yeah, these things are severely itchy to people that have streptococci infections. Which streptococci is like a whole genus of bacteria. There's a whole bunch of bacteria that can do this, and there's variations in there, but y'all don't need to know all that. All right, there's also cellulitis, which is a deeper infection. Subcutaneous, again, beta hemolytic streptococcus. there can be pre-existing wounds that these bacteria can. This is like a problem with scratching, is that if you scratch it, you open up the wound, streptococcus can come in and cause even worse problems than what it was before. Like you had a bug bite before, and now it's like a whole bacterial secondary infection. So legs are the most common site just because of surface area. Because a lot of your skin surface area is on your legs. Like if you break it down. But also your hand or your arms are second, right? Because it's your second biggest surface area, and then your torso. Ears are really exposed to the environment as well. Infection of the inside of the eye socket is the orbital cellulitis. So with this, you get a whole bunch of redness, heat. This again, all these things are applicable to inflammatory reactions, right? So it's just you get an inflammatory response to a bacteria, right? That's all these rashes are here. And so treatments here, here it is. Antibiotic therapy, and then just try to make sure your patients are comfortable and prevent infection or spread. This would be encouraging them to cut their nails and don't scratch because, right, that's what happens, right? You have one little bug bite, you scratch it, you get a streptococcus infection. It becomes even more itchy, you scratch it more. We've just opened up the wound even more, and you've allowed it to spread even further, and that's why. If that's ever happening with scratching, then it's like that's a very bad outcome, and so you just got to not scratch at that point. All right, so this is, I think I meant to say viral infection here instead of bacterial infection, so fix that on your slides, but it's pretty obvious with the meat of the information here. So these are viral infections. The biggest skin infection with viruses is HPV, human papillomavirus. Where what these do is this is just some viruses that infect. The thing is, they don't really infect the outer dermis level very well. But the problem is if you have a microlesion that just provides a little bit of exposure to the underlying keratinocytes that are living. Because, right, viruses, you'd think the outer layer of your skin is dead. Viruses need a living cell to infect. There really shouldn't be a lot of skin viruses. Well, what this is doing is it's getting inside the living part of your skin, and then it's replicating downward into the root of your skin. And there's a whole bunch of research into this. And we have like 2 or 3 of them over in the med school over here who research viral infections. But they replicate downward, and then what they do is they cause a whole bunch of problems with this, and then they disfigure your skin and cause these warts, right? So you have an irregular thickening of the epidermis after this replication occurs, and then if this occurs in the genital tract, especially with women, it can lead to cervical cancers, and that's where you've heard of HPV-16 and stuff like that, where these are highly cancer-causing strains of viruses that cause severe amounts of cervical cancer. And so that's why vaccines, what they do is it gives your body this antigen to where if it ever gets exposed to HPV, it kills it before it can really go through significant amounts of infection and this mutagenic process. It's the cancers themselves are caused by the production of these proteins that are oncogenic, and so it's like a protein that causes all these mutations and progression of cancers from this virus. And this is what we're kind of talking about whenever we say that metaplasias go into neoplasias. That's what's kind of occurring here. And I think if you look back at the neoplasia slides, you'll see those slides as well. So what you want to do here is that if it's just a wart, you can remove these pretty easily. And what you're doing is you're removing all the skin that's been infected, and you're just lifting it to where you're just removing all the virus, right? It is pretty localized to wherever the warts are. It doesn't spread outside of it. You just need a little bit past it to make sure you got the wart, and then you could do that. Another thing is you can just freeze kill all the viruses with extremely low temperatures. And so if you go to the doctor and you have a wart, they'll I think they just put liquid nitrogen, which is like negative 200 and whatever degrees Celsius, and it literally kills everything. Your skin cells and the virus, the virions themselves, to where everything just dies, and then your body will gradually remove it. Also, it shrinks a little bit to where it sometimes even just falls off through and through. But you can also just cut it out. The point of all this is just to remove it. And then obviously you can get vaccines if you want to prevent the cervical versions of all of this. Vaccines are great for preventing that at the immunological level. For pustular disorders, this is things like acne, rosacea. A lot of people have seen acne before. So what's going on there is that you just have an infection of oil glands, and because of that, you have immune responses. Immune cells get recruited into that site. There's like a small little cavity there to where immune cells just get flooded in there, and you have a collection of pure white blood cells. And if you've ever like popped an acne before, or like a white head or a black head or whatever they're called, you can see that there's a lot of white that comes out. That's literally pure white blood cells. Specifically, probably the first to be recruited are the neutrophils that we talked about. It's pretty much it's like 99% neutrophils when you pop acne, whether you're a blackhead or a whitehead. Yeah, so that's really what's going on here. There's also with blackheads, you have like a whole bunch of oil glands that get released as well, and it's like solidified oil with that one. It's cell type though wise, it's like it's mostly just immune cells. Regardless, these can happen anywhere: face, neck, back, chest, shoulders, legs. Though it's like it can be all over the place. And this is regulated. The production of oil is regulated by hormones, especially during puberty. So that's why around 85% of teenagers are affected by this, because hormonal changes at that time. And then treatments kind of all over the place. You can go antibiotics, skin care, topical vitamin A derivatives, or oil retinoids. But some of these have severe side effects, each having their own little. Specifically, what that might be is dependent upon whatever the agent is. But yeah, the goal here is just to socially restore whatever insecurities that might be a thing. I don't know. I've never had bad acne, so I don't really feel those pressures. I've gotten like small little amounts of it, and I never felt like weird about it. But some people really feel bad about their acne. Like my sister was like had really bad acne, and I don't know if she still does or whatever. But
Well, lucky you.
she well, it's like not a thing for me. It's like I don't know. I feel like I wouldn't care either way, but who's to say? I know that my best friend, he was like that chemistry researcher. He has really bad acne, and he just doesn't give a shit. He's just like whatever.
I did.
Yeah. That's crazy. Yeah. Yeah, I mean it's so yeah, that's like the social pressures that a lot of like the patients will have to deal with as well. So it's good job with empathy. Yeah. That's the thing. It's because it's regulated by the hormones, right? And so you have like stress. Stress is associated with cortisol and other hormones as well. And so yeah, all those are like correlated. Um, yeah, when I used to play football, my chin strap caused like acne all around here, and so that was my only time I ever like really broke out. But and you like broke out on your chin. Man, that must have been a nerdy time in your life. The Yeah, so this is another thing. So this is what we're talking about. We're talking like you got to take a look at what's going on with where these rashes occur as well. So you can have allergic responses to various things. So you can see here like, well, yeah, if you were wearing like some sandals and like if they were like leather sandals and you're allergic to leather or something, it's around like where that leather was making contact with your skin. Same with like henna. This is not something I don't fully understand, but it's like apparently like some tattoo or something.
Yeah, it's
like temporary though, right?
Temporary tattoo for like events when people are getting married or a baby or.
Yeah.
It's cultural.
But yeah, some people are allergic to whatever the dye is that they put in there, and so like yeah, they'll have this like rash, which I don't know, it kind of looks cool, but I don't know, you don't want that. I'm sure it's annoying. But yeah, so it's like where the rashes occur will give you kind of about what's going on. Because if you just saw like this skin super zoomed in and you didn't have any, and you didn't have like that shape, like it's more confusing. Like what's going on? Why is this person getting a rash? But then when you see the actual shape of the foot, you can see oh, it's like you're allergic probably, right? Right. Yeah. So right, this atopic dermatitis, eczema. It's really really itchy, chronic inflammatory skin disease characterized by papules, vesicles, erosion, disturbance in the epidermal barrier that leads to increases in transepidermal water loss and dry skin. Um, Begins early in life. This is what I thought you were talking about, eczema, but it's not this.
Oh, this is psoriasis.
Yeah,
Psoriasis.
because this has got dry skin in it. But
Well, I think like just like the term
yeah,
or whatever is like xerosis or xeroderma or something like that for dry skin, just like psoriasis.
but not you were talking about on the face though.
Oh.
Yeah. But regardless, begins early in life. Bad problem for kids and stuff. And then you could have allergic rhinitis, which is like inflammation of the nose, obviously, and asthma as well. Really appears in the face, neck, and upper trunk, upper body. You also have papulosquamous dermatosis, and that's where you have all these papules and plaques all around your body. You have psoriasis, which is a chronic and inflammatory skin disease, raised plaques, very scaly. This is what we're talking about with scaliness right here. It's a picture of it. Affects very small amounts of people, but it's mostly like a immunogenic disorder. People have genetic predispositions because your genetics also establish what your immune system is, right? Characterized by epidermal cell turnover. There's a lot of good topical agents, systematic treatments, immunosuppressive drugs because it's caused by your immune system, and you just want to suppress that hyperkeratosis and epidermal inflammation and abnormal differentiate. All right, yes, so that's all the primary skin disorders. Make sure to study that. We also have UV radiation. This is where we talked about this. Why did we talk about this? Skin?
Vitamin D.
No, I'm talking about like last week. We talked about this. I don't know why. Anyway, sunburns, right? You have so sunburns is where you just exposure to this UV radiation. What's going on here is right, the sun is hitting your cells, your keratinocytes. The UV radiation is penetrating the outer layer, the epidermis, and it's going to the dermal layers.
Yeah.
Yeah, he done get sunburns. Yeah. And I don't know, but why are we talking about that?
I don't remember.
Yeah, I don't know. Whatever. It's fine. So it's getting to your skin, and it's the UV light is mutating the DNA within these keratinocytes, and so what happens is that those cells recognize that, try to kill itself, and then it becomes toxic and it kills itself, releases all these these cellular components into the body. Your immune system recognizes these cellular components that are supposed to be inside of cells but aren't, and then have an inflammatory reaction to it. So it's a immune-mediated recognition of UV damaged cells that cause sunburns, right? And so obviously it can range from mild to severe. What's great though is that if you have like small levels of UV treatment, and this is like what tanning does, is that it's your melanocytes that get hit with this, and then your body has like a physiological response and starts to produce melanin instead of like having all this toxic reaction. So the UV rays will hit the melanin instead of the cells, and so you have this like anti-radical reaction to prevent this, and so that's why tan people don't get sunburned, or black people, I guess, too, right? uh, so yeah, the things you want to do is that if you just want to put on sunscreen, again, really bad problems for like mild skin people or albino people. That's why you want to be putting on sunscreen, and then wear clothing, which is just another version of blocking those UV rays. Skin cancers. This is what we're going to pretty much end on, I think. And that's where you just have these cancers of the skin, right? So everything we've talked about with cancer is applicable here. You have these irregular borders with skin cancer. Skin cancers can hit pretty much a lot of different areas, where they are basal cell squamous cell carcinomas, or a basal cell carcinoma. But then it can also hit, I think, no, it can also hit melanins. Oh, here we go, melanomas. So melanomas occur where it's a cancer of the melanocytes themselves, which is are the most commonly in areas where you have exposure to sun. This is like coastal areas about people going to the beach all the time, and our runners have a lot of, like, people who are runners and bikers have like a lot of melanomas a lot of time. Our Cam develops that. Oh, there you go. All right, you were right. So yeah, that's a way to recognize the different types of irregular skin cancers, about why. So yeah, make sure to take a look over that and review that. But it looks like you've already learned it to a certain degree. There's also thermal injuries, and this is like gross, like really gross. So you have skin issues. How are we doing on time? Oh, okay, we're good on time. So yeah, we have like skin tissue injuries caused by excessive heat. So this is where you have burns, pretty much, right? So burn injuries are a significant problem. More than 500 people in the U.S. and even 4,000 deaths per year. There's a lot of work-related burns, firefighters and people who work in like industrial plants where they just have high heat exposure. Severe burns induce responses that affect almost every organ system. So there's a lot of inflammation. To repair that burn, your body has to go through a lot of metabolism to go through the cell division to heal over that wound, and you can even cause problems with your muscles because the burn was so bad. And because you have these metabolic issues, you can have insulin resistance because your body was just responding to so much insulin. We're going to be talking about this a lot with regard to. Oh no, I guess I got rid of that lecture. Yeah, there's this concept called. It's like you have something called shock as a result of burn injuries. It's whatever. Don't worry about that. But so what happens is that at temperatures at 111 degrees Fahrenheit, these proteins begin to break down. And there's different severity about how long you were exposed to things, and then like the surface area of your body that really determine how bad these burns are. But what results is a hypermetabolic response that leads to increased metabolic nutritional demand, and that's to regenerate the part of your skin that was burned, right? And so like there's all these nutritional demands that need to be met. Another problem is sepsis, and that's where y'all know what sepsis is? So it's like bacterial infections, but like at a grander scale, where you have these are particularly bad because you've exposed so much area to the outside environment. Bacterial infections and other microbes can get in and cause all these, like a huge amount of infection, and even to the level of the blood, and then your immune system is going to react accordingly in a way that's very pro-inflammatory and very damaging to the cells, or to potentially your body. So there's different degrees of burn. First degree burns is mostly just a bad sunburn, kind of red, dry. It's really painful. What's important to note is that first degree and second degree burns are painful, right? You can see those characteristics there. But third degree and fourth degree burns, which are just significantly worse, yeah, this one's bad. I hate looking at these pictures. There's like 5 lectures that I hate giving, and this is one of them. But anyway, what's going on with 3rd degree and 4th degree burns is that it's painless, and so that's weird. You'd think like, oh, you're causing more injury, and so like you'd think there'd be more pain, right? The problem is that it's so bad that you've literally burned off your nerves. So it's like you don't feel it because you don't even have your nerves there. It must be really, really rough for these people. But yeah, different amounts of healing times, and so yeah, just make sure you know the pain thing about why, because that's the only non-intuitive thing here. Everything else is pretty intuitive with regard to like the severity is correlating with how long it's going to heal. Sometimes these things get so bad that you need amputation and functional impairment, and it can cause gangrene as well.
This girl I went to high school with like, this had to be like her junior year at LSU. She put out a grease fire with water. And so
Yeah.
she has like all these burn scars all over her body.
Yeah, there's some people who just don't know how to deal with that. Yeah.
And then she posted about it, and then people were commenting like, how have you never heard to never do that? And so she's losing it.
That's embarrassing. Yeah, that's so hard. I mean, you just hear people put out fires with water, so that's just where people go to. But yeah. All right. So with regard to these thermal injuries, there's like skin grafts that you do. It's kind of interesting. So what people do is they just take different parts of their skin that is healthy. They'll like score it to where you can expand it more, and that gives like a higher healing capacity surface area wise. And then both the scores and the area around the edges will start to heal in, and you can but you need these like skin grafts to really.
Is that like skin graft?
Yeah, that's exactly. This is what a skin graft is. So you get these skin grafts to really repair it. It's got a lot of technical little things about it, just like everything else in the medical field. But yeah,
use like fish?
I've heard of pig, not fish before.
I
Maybe people do some weird stuff.
And this guy got like a fish. I need to find it. It's like the craziest page.
Yeah, Instagram's a great way to learn about.
It has to be.
Or maybe it's like
a graph on
it might. Well, what I could see is that like fish like secreting some type of oils to keep things like lubricated, and then like there might be growth factors in fish that like can help grow stuff. I don't know. There's some weird stuff in biology, and some of it's so kooky that it even works even. So I'm not shocked by anything at this point, but that one would be a little bit intriguing to learn.
On Instagram. I actually just came across it. Fish.
So there's also.
It says certain fish skin can be grafted onto burns and diabetic wounds. A healing protein. Someone got it done in 2017 in Brazil.
Oh, okay. So it's like a rare treatment, sounds like. Yeah.
It's a
new treatment. Well, we'll see what happens in them. Hasn't squeaked its way into pathophysiology courses at least, though. Okay, so the last 2 things are just some scars, different types of scars. This one being hypertrophic scars. This is a result of tissue tension. So what happens here is that this is when wounds heal, there's a whole bunch of fibroblasts that come along, and the problem with fibroblasts is that they're not very elastic because of the collagen that they produce. And so what happens is like these scars that are really kind of rigid form, and they're very red, and because of their hypervascularization, there's a lot of blood vessels that flow throughout this area, and they're typically raised because of the collagen also itself, and they're rigid because the collagen's not very elastic, right? Skin is not pliable. This contrasts to keloid scars, which is excessive growth. So this is where you get like a cut, and then you have excessive growth around that cut. Again, with collagen, because of the collagen, it's usually firm, shiny, rubbery lesions, varying color, growth beyond the boundary of the origin of the wound. So it's because the skin is like overgrowing wherever the cut was itself. And it's more frequent in highly pigmented individuals. And then there's a contracture scar. These are kind of gross, but It happens with burn injuries a lot where the skin will like thicken and tighten up again, probably because of that collagen, and then it's not very elastic. So if this occurs around a joint like this guy's elbow, it's like you can lose mobility of that elbow, loss of joint motion and structural changes because of your skin itself. Yeah, it's gross.
Could you hypothetically cut it?
What? Well, the problem is you cut it to restore the motion. You're saying.
Yeah.
So you'd have to like really go in. I mean, maybe you have to really go in and do some pretty pointed cuttings of it. And then the problem is like if you have one flap of skin here and you cut it and then you extend your arm, you've opened up a cut that was like a straight line like this to like a whole surface area that's about this big now. And then it's like, then do you have to graft more skin to that area or something? You know, it's like complicated. So I don't fully know the answer to that question, but possibly. But yeah, I'm guessing this stuff gets mucky real fast. And then also it's like there might be a problem with the burn of the actual muscles and ligaments and tendons as well, right? So it's not just the skin that's like holding it as like a patch over it. It's like the actual muscles that cause the movement are also damaged as well. And then there's a whole bunch of lesions. I'm not going to ask y'all anything about this, but y'all can take a look at it. These are just different types of stuff. You can take a look at it if you want. But that's it for this. So any other questions here? Skin lesions is one of the bad ones. I wouldn't say it's the worst as far as pictures go, but it's a bad one. The worst one's STDs through and through. It's disgusting.
We're gonna go over that?
Yeah, we're going to go over that. It's going to be a blast.